A recent study published in the Lancet revealed that 60% of liver cancer cases worldwide, 3 out of 5, would be prevented by tackling key risk factors like viral hepatitis, alcohol consumption, and metabolic dysfunction-associated steatotic liver disease or MASLD. Lancet study highlights that 3 out of 5 liver cancer cases are preventable by addressing key risk factors. But what are these risk factors and how they contribute to liver cancer? Dr. Kaushik will share more details.
The liver disease starts early with fatty liver disease. Usually this fatty liver is neglected, and then it progresses to fibrosis, and then it progresses to liver cirrhosis, and then it ends up in liver cancer. When we diagnose this early in first or second stage, the liver has highest regenerative capacity. So that what happens is the liver disease can be completely reversed to normal. But if you don't intervene here, if the stage crosses to stage 3, then it progresses to cirrhosis and then it ends up in liver cancer. Unfortunately, the problem is in liver disease, early stages, the patients don't have any symptoms and signs. The time when they produce symptoms like jaundice or blood vomiting or pedal edema, the diagnosis is always in stage 3 or stage 4 disease. So, voluntary screening and regular health checkups is indicated to check for the liver status. And one more thing is, we should also know what causes this liver disease. The most common cause is being alcohol, as we all know, and the second is viral. So what viruses is hepatitis B and hepatitis C causes a chronic liver disease, and the third important cause is MASLD.
The study also projects that liver cancer cases could nearly double by 2050 from 870,000 cases to 1.52 million annually if current trends continue. But can this be reversed? Let's hear it from the expert.
I would suggest to go for a liver protective lifestyle. That includes significant weight loss, at least 10% of the weight loss from the existing body weight, adapting to healthy food habits, avoiding alcohol, processed food, junk food, and patients with diabetes should go to a proper dietitian and have a regular medications and have a tight sugar control. And people with obesity should also visit a healthcare professional, and there are a lot of methods to reduce weight and the new medications available in the market which helps in significant decrease in the body weight. And also screening for hepatitis B and hepatitis C and taking a proper vaccination is required.
Speaking of MASLD, the study notes it's a rapidly growing cause of liver cancer linked to obesity and diabetes. But early detection and lifestyle changes help mitigate the risk.
People with diabetes and obesity are vulnerable for developing MASLD. What happens in these patients is the fat gets accumulated in the liver, and this process happens very slowly and silently. And over time, what happens is this fat will secrete certain chemicals which damages the liver cells and which leads to fibrosis and then cirrhosis and which leads to liver cancer. During this time, unfortunately, patients will be asymptomatic. They will not have any symptoms. So patients with obesity and diabetes should voluntarily go for liver screening and check for fibroscan to know for the liver fibrosis status.
The report also emphasizes the importance of a hepatitis B vaccination and screening for hepatitis C. Doctors say that these measures go a long way in preventing cancer and need to be scaled up.
Public knowledge when it comes about hepatitis B and hepatitis C, it is very limited. So what we have to do is we have to create awareness about these viral diseases in public. And hepatitis B vaccine is extremely effective. Around 98 to 100% of protection rate is achieved with vaccine. And unfortunately, there is no vaccine for hepatitis C, but there is excellent treatment for hepatitis C. And B also has excellent medications.
Finally, the study projects that alcohol-related liver cancer will rise from 18.8% to 21.1% of cases by 2050. In such circumstances, it becomes important for individuals to reduce their alcohol consumption, and such practice should also be made a part of public health policies.
Alcohol consumption is increasing every year. This is putting people under risk for developing alcohol-related liver disease. So alcohol accounts for 20 to 30% of liver cancer mortality. So daily drinking, binge drinking of alcohol should be avoided, and if the alcohol quantity and quality plays a significant role in development of liver disease. The public health policies will definitely help in reducing the alcoholic-related liver disease and alcohol consumption. So how we can achieve this is by creating awareness from high school, by educating them about the ill effects of alcohol. And also awareness camps should be to be established so that patients know about all the alcohol-related side effects. And the label should be, with all the side effects, should be stick in the bottles. And we should also increase the de-addiction centers and also increase the healthcare facilities for early diagnosis of alcoholic liver disease and treatment. And what we can do is legal age for alcohol consumption can be increased. And we should significantly come down on alcohol shops.
The message is clear. 60% of liver cancers are preventable, but it will start with action. Get vaccinated, screen for hepatitis, reduce alcohol consumption, and prioritize a healthy lifestyle.